Hi, I'm Dr. Geoff Cowie from Vitality Chiropractic, and today I'm going to discuss with you and show you the effects that obesity has on the spine. Now, if it was a Family Feud question, it was posed, what is the number one health problem associated with obesity? The buzzer would go off, heart problem. Everyone gets a heart problem. Number two would be diabetes, and you're probably not wrong. But these problems can affect some, they might not affect others, because being overweight and obese has a large spectrum of people which it affects. I'm seeing a lot of kids these days that are coming in which are overweight. But there's one other one which you probably have never thought about. The number one problem that I see in everybody as a chiropractor, in everybody that's overweight, is osteoarthritis. Osteoarthritis, cut down to its basic, is when your bones start to rust and corrode and they just get tighter and tighter because they're wearing away. They wear away when they've got too much weight on them. This is consistent across the board. Doesn't matter your age, it creeps in and it will happen. I've got the x-rays that I'm going to show you of a woman who's currently 140 kilos and has opted for a gastric sleeve operation, which is scheduled for 2 months' time. Now she's done it all. She's dieted, she's tried to lose weight, she's done everything. She's had 5 kids, she's worked, and now she's decided enough's enough. I've had enough of the pain, I want the weight gone, and I want my life back. She asked me to show you what happens to your back when it's been loaded for 30 years with too much weight. But to understand what we're going to look at on the x-rays, I'm going to show you what normal looks like first. So when we look at a normal back, we're going to be dealing specifically with the lower back. That's this area here, okay? There are 3 main things that I want you to look at. 1, you should have a nice gentle curve through the spine. Number 2, everyone's heard of discs. You know, you slip a disc or something of that nature. The discs are our shock absorbers in the body, and they're designed to keep the joints apart, and they're crucially designed to create a hole where the nerves come out from the spinal cord and then innervate every part of the body. So let's have a look at that. So the discs are here. They lie in between the vertebra, and they give you shock and suspension and disperse weight evenly. And finally, number 3, these holes. You can see them just in here. These holes are the exit points from the nerves from the spinal cord, okay? First of all, let's look at that curve. It's a lot bigger than this one. And why is that? Because there's been an excess load at the front that's been pulling it forwards. How does that then affect the body? Are these holes. These holes here are where the nerve roots come out from the spinal cord and then innervate every organ, muscle in the body. It's pretty simple. If that hole gets too small, the nerve gets pinched, it gets irritated. The first effect you get is pain. The next problem you get is health problems. And you can see here, nice big hole, nice big hole, nice big hole, no more hole. So having the excess weight on the front of her body here, this is her back, this is where her stomach is, it has pulled that disc down, closed it up, and now that hole will damage and health problems. She's taken the plunge, she's getting that gastric sleeve operation, and her life is going to change dramatically. This woman has lived with chronic pain for the last 15 years. And on top of that, the nerve which comes out of here, it innervates the bowel, the bladder, the nerve, the muscles that go down the legs. And because that's been pinched, she's had a whole lot of other health issues as well. The point I'm trying to make is, act now, don't wait. When you get to this level of osteoarthritic damage and closure of those holes, it's irreversible. You can do things to make it feel freer, but it's never going to change, okay? Talk to the professionals. Talk about what your options are, a gastric sleeve, a lap band, or whatever way you can to get the weight down. The point I'm trying to make is, don't wait. You know, don't worry about what society says. If you've tried everything, if you've done the diets, if you've done the weight loss, and you're still living with permanent back pain and simple innocuous activities such as standing up, walking, are becoming really difficult, make an appointment. Talk to Weight Loss Solutions Australia and find out if they can help you. This is irreversible. This is too late. I hope you enjoyed this presentation. I'm Geoff Cowie from Vitality Chiropractic, and I wish you well. All the best. Bye.